This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio. Love to talk to you on any subject that you have in mind. 888-630-9625. That's 888-630-9625. That's how you find us here on this rather cold, semi-almost winter day. It could be worse. It could be Buffalo, New York, south of, or just a little bit north of my hometown. Can you believe 72 inches of snow? That's just not okay. There's nothing okay about that. Even when I was there, a major snowstorm was like 38 inches, 39 inches. Matter of fact, that's why we left and we came here. But nevertheless, I feel bad, and I know why I'm not there anymore. Have a very special program for you and a very special guest, somebody that is near and dear to our hearts. People that go to him find his expertise and capacity to be able to look at your particular situation and not only do symptomatic resolution, but actually fix the problem. What am I talking about and who am I talking about? Well, who I'm talking about is Dr. Michael Chung. Dr. Mike, how are you, buddy?
Thank you very much for having me on your show. It's an honor to be here.
Mike, it's always fun to have you here because it's fun to go back and forth. People don't realize that so many conditions start in the mouth, and either they start there or they're intensified by, and we're not just talking about the disease processes where you might see oral cancers and erosions and infections and so forth, but mechanical obstructions and neurological differences that cause the body to present abnormally, if you will. And today, I told you before the program, I said what I want to talk about is something that we see in the office way too often, and there's multiple reasons for them, but this particular condition that affects, some authors say, up to 20 million people in the United States has to do with that little mechanism called sleep apnea, and it's awful.
Yes. Well, sleep apnea is a very serious problem that can cause, obviously, major health problems if it's left untreated. And there's a couple different types of sleep apnea, actually. Most common being obstructive sleep apnea, where the airway is compromised. And then there's central sleep apnea, where some patients, which is not so common, but some patients, they're just not getting the proper signals by their brain to breathe properly throughout the night.
So you can have one of those two things, but I also know from talking to you in the past, there's sometimes a mix in that paradigm.
Yes, that can be a complex sleep apnea where some patients have a combination of the two. But most of the patients have obstructive sleep apnea where their airway is compromised in some way. It's usually their soft tissue and the palate is open, relaxed, and is actually blocking the airway. In
our practice, we see people that come in and they present with fatigue, or they present with headaches, or they say that they can't focus, which is a lack of oxygenation to the body, and even to the place of the inability to repair, because the nighttime process of sleep, where your cortisol level begins to rise and so forth, is the restorative reparative cycle of the body. So here you've got somebody who is suffering, and some of these people are way too, they're overweight. Some of them are, they suffer from allergy reactions. Some of them have a neuromuscular mechanical problem that kind of resides within our two fields. And this is the thing that we have so much interest in, and we work with a lot of patients with you to correct it permanently when that does exist. And what we're talking about is the imbalance of we'll call it the vertical dimension of your mouth. When you open and close your mouth, that vertical dimension and how it sits, that position of your jaw, your temporomandibular joint, that joint that sits at the side of your face, has to be exact. If it's not, it can cause all kinds of problems.
Yes, correct. Basically, you were talking about the occlusion, most people are thinking of just your teeth coming together, but it's much more than that. There's a second and third dimension to this, which is basically the hinges, which is your joint, and then the muscles that control your upper and lower jaw. And if all three of those factors are not balanced perfectly, then you can have lots of issues such as TMJ problems, sleep apnea, and causes a multitude of problems.
Mike, let's talk a little bit about how these things come about. I mean, we know that sleep apnea conditions can be significant, and we can debate back and forth of where the minor, where the major presentations are, and we'll get into that a little bit today. But how do they come about? How does somebody all of a sudden show up and they've got problems? And medicine's going to say, well, if they're snoring or if they stop breathing and so forth. Okay, well, those are symptoms, but why?
Well, I think a lot of that has to do with during development, when you're younger and you're not breathing through your nose properly, whether during those times you've had some form of allergies that may obstruct your nasal air passages that prevents you from having a normal breathing balance. Because what happens is your upper jaw and your lower jaw are developed, and during those times your cheek muscles on the outside and the tongue muscles on the inside of your mouth, they kind of have to function properly to develop your arches properly so that you have plenty of airway. And in people that breathe through their mouth, their tongue is in a position where it's putting that balance out of position, and usually you end up with overclosed bites and retruded lower jaw that causes a lot of this airway obstruction.
My guest in studio today, Dr. Michael Chung, owner-director of Soft Touch Dental in Oakton, Virginia. Mike is an amazing intellect when it comes to neuromuscular dental appreciation. That means, what are we talking about? We're talking about the dynamics of how the jaw, the temporomandibular joint, and the vertical dimension of your teeth are in a healthy situation opposed to a non-productive, mechanically dysfunctional situation. You mentioned a couple things, Dr. Mike, and you said retruded and retracted and so forth. I understand that, but our listeners may be sitting there, what does that mean?
Yes, basically, when you're normally sitting or standing, your upper and lower jaw, the way their bite comes together, when they're functionally in a correct position and in correct neuromuscular balance, your muscles are nice and relaxed, your joints are in a nice healthy position, and you have plenty of air that goes through your nasal passages or through your oral passages and down your windpipe, and there should be a nice opening there. Well, in patients that have these retruded positions of their lower jaw, as you can imagine, if your jaw is pushed back, your tongue and all the soft structures there is going to also get pushed back, and that's going to decrease the airway. And in those patients, it gets even worse and exaggerated when they lay down to go to sleep, because they're now not only are those tissues pushed further back from the gravity, but in some of those patients also, when they're sleeping, all these tissues become overly relaxed as well, and then that collapses the airway completely.
So, in our business, my brain's going through this whole process as you're talking, and I'm visualizing the whole mechanical structure of the head-neck mechanism. And so you have the jaw, you have the muscles, you have this little bone that sits kind of at your throat level above your voice box called the hyoid bone. And there's actually about 7 muscles that attach to it on each side, and they help balance. It's lovingly called the gyroscope of the body because it keeps your head in position. And then you have all the muscles that help open and close the mouth. You got 2 major ones, the buccinator and the masseter. Then you got these guys kind of sitting back in the hinge called the pterygoid. And so you've got that junk in there, right? Plus you got everything else. You got the spine, you've got the muscles behind the neck, and you have to take all these guys and figure them out. You have a very unique way of finding out whether or not that jaw is in position properly and which of these guys are not firing the way they should. You want to talk about that a little bit?
Yes. What you're referring to is a software program called the K7, and what it utilizes is several different technologies, such as EMGs, which is electromyography, where we can actually find out the correct posturing of each one of your muscles that pertains to your movement of the jaws and chewing and swallowing. There's also sonography, which we listen to your joints in different movements as you're opening and closing, and the third factor is what we use is a magnetic solution to trace the movements of your upper and lower jaw and figure out how far they may be off their norm, and we can actually use that computer instrumentation to actually figure out the optimum bite position. It almost always correlates to the correct airway as well.
And there's many different ways of correcting it, from redoing some surfaces, with a lot of known technology, but also in doing full mouth reconstruction if necessary, and also dental bracing, which we're going to talk about in the second half of the program. But it's an amazing diagnostic tool, and for our audience to really appreciate how significant the dimensional piece of the mouth is relative to the body and everything that happens. And this will be kind of a prelude to what we're going to talk about in the second half of the program. When I was first in practice, I think it was about 2 years in practice, and those who listen to the program know my specialty is something called applied kinesiology, and it's an interprofessional organization throughout the world. And there was the story is this young girl. She was about 11 years old at the time. And she came in, and I would see her and her family almost on a monthly basis, and they would get corrective structural care. They would get acupuncture. We would look at their nutritional products. This little girl was an amazing athlete. She was a gymnast. She had a beautiful body, perfectly straight spine. And she was going to go to her dentist after my appointment, and he was going to put on orthodontic braces, and then he wouldn't see her again, which would be unusual, for about 7 weeks, because she was going to go to her grandmother's for the summer. Mm-hmm. So she goes to the dentist, and she has the braces applied, and I don't see her again till just before school starts. When she came into the office in school, this little girl who left me in June now presented with an 18-degree plus curvature that was progressing. And I just flipped. And apparently what the guy did, she said she was in pain for quite a while. He had tightened the braces down too tightly because he figures, I'm not going to see her. Here's some medication. It'll get rid of the pain that I know you're going to be in. And so I got on the phone, and there was a guy by the name of Dr. Mike Marfino at the University of Buffalo School of Dentistry. And Mike was a amazing guy. He was also a member of the International College of Applied Kinesiology. And he said, look, think about what you know. When you move those teeth, you're torquing on alveolar ligaments, you're pushing muscles that haven't had the chance to adapt, and your body is compensating. Your spine is compensating. That's where the mechanics have to go. That's what we call the neurological tooth reflex to the rest of the system. Had we been able to do it your way, with a K7, knowing where this thing should be, and putting the braces on properly, this child would have never, ever suffered the effect. Fortunately, between the two of us, we were able to get her back to normal. It took us about 3 months or so, and she got better. So we're going to talk about that dimensional neurological problem and how it affects in health conditions. We're coming up to a break, and if you have any questions on TMJ problems and how they should relate in a normal, healthy situation, or in some cases when they're not adapted properly and they can cause problems, here's an opportunity to talk to one of the best that I know. Call us at 888-630-9625. That's 888-630-9625. Dr. Michael Chung is my guest in studio. We're going to talk to you a little bit about Caring for Others, a 501c3 foundation that is at the end of the year doing a fundraiser that I think you need to take advantage of. Don't go away. You're listening to Dr. Tom Roselle Live.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. Give us a call, 888-630-9625. That's 888-630-9625. As I said earlier, thank you that we don't live in Buffalo, New York. Those poor people are going to be in trouble this week with that rain that's coming in. The roofs are going to even go down even more. Not a good thing. Our prayers are out to them. 888-630-9625. My guest in studio, Dr. Michael Chung. Dr. Chung is the owner of Soft Touch Dental in Oakton, Virginia. You can give him a call at 703-319-6990. That's 703-319-6990. And for all of Dr. Tom Roselle Live listeners, Dr. Chung is offering a complimentary consultation, x-rays if necessary, a value of $300 for $79. So if you have a question on what we're talking about, this neuromuscular problem that may cause sleep apnea conditions, and when we talk about dental bracing the next half, even more so as well, 703-319-6990. If you just want to talk to him, no charge whatsoever. He'll do a complimentary consultation. If you want a full examination and x-rays if necessary, $79. And that's a $300 value. Listen, we had to twist his arm to get that done. So give him a call, 703-319-6990. We're going to go to the phones, and then we'll come back again. Laura, thank you for being patient. How can we help you?
Hi, Dr. Tom. I have two questions. One about a friend of mine who has one of her ducts in her the nipples in her breast is secreting some fluid, but she doesn't know what it is. It's transparent. It's not colored.
It's not colored. It's a clear secretion.
Clear secretion.
Okay,
yeah.
so
and then her doctor, she had a mammogram a while ago. And then they said, you have to do another mammogram. She didn't do it, and she went and did ultrasound, and they took a sample of that secretion and sent it.
And it came back negative?
It came negative.
Yeah, okay, so
the
Laura...
doctor is telling her, you have to do a duct.
Okay, Laura, hang on a second. We don't have a lot of time, and I do want to answer the question, okay? So a clear secretion is generally normal, even a yellow or whitish type of secretion. More often than not, those are normal secretions that can happen generally at any age, depending on many things. It can be suddenly the pituitary gland is sending out other types of signals that are not normal for that age group, and the breast is going to kick in, or the breast has got to drain. It has toxin it has to get rid of. You have to look at the hormone, not just do mammography, not just do any of those things. You have to look at the hormone levels to see if anything has shifted that way.
Yeah.
Additionally, if somebody was in my office and that was happening, they told me what you just told me. I said, listen, in addition to what you're doing, do a thermography. A thermography is going to show the heat differentials within the breast tissue that can be predictive of other types of problems. So you use that along with other types of examination, and now you have a better understanding of what's going on. Thermography Centers of Fairfax is the outfit that I would call. Give them a call, have them do it. It's non-invasive. It's not going to hurt her.
She doesn't live in this state. She lives in Massachusetts.
Okay, well, in Massachusetts...
I told her we don't have thermography here.
Well, I think that she's not correct, and there's a website. If you send me a note on email, I can look it up for you, and you can send it on to your friend. I think that's appropriate. Laura, we're coming up real quickly, but
okay, now, the important thing I wanted to know is this Dr. Graham. They put a chemical color, a dye or something with a catheter, and she's afraid because this might cause more serious trouble.
There's a lot of side effects to those types of things, but you have to be very careful of what the procedure is. I would find somebody in that area that knows what they're doing in a conservative functional medicine protocol. We have those referrals. Give us a call. I will recommend somebody that I would send my own wife or my own family to without any trouble. Laura, thank you for the call. I appreciate it. I wish we had more time, but we're coming up to the break, and there's a couple things I do want to cover. Dr. Mike, we didn't get too far into our discussion in this last very short segment, but we will when we come back, and we're going to talk a little bit more about neuromuscular occlusion as it relates to sleep apnea. I want to know how to fix, and then we're going to talk a little bit about dental bracing, particularly Invisalign, and we're going to see how that fits into this whole subject that we're dealing with, and they're both very profound if they're done properly, and that's the key, and that's what I want our audience to understand, is that just slapping some braces in place or trying to correct a sleep apnea condition by some type of orthodontia in a traditional sense is not the way it should be done. There's something that they really need to understand, and that's your field of neuromuscular appreciation, using Case 7, using other instruments that generally really make it specific for the patient. Again, we want to remind you, Caring for Others, 501c3 Foundation, has an end-of-the-year fundraiser. Go to caringforothers.org. That's caringforothers.org, and look it up. We'll talk a little bit more about it when we come back after the news. You're listening to Dr. Tom Roselle Live. Don't go away. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live in studio, 888-630-9625. That's 888-630-9625. That's how you find me here, and how you find me off the air is real simple. Go to rosellecare.com. That's ROSELLECARE.com. And send me a note. We will get back to you. If you need to talk to us beforehand, 703-698-7117, and ask my staff to have one of my doctors call you, and we will get to your problem one-on-one, and you don't have to talk to us here. But this is an opportunity. This is the place that you call. So, Dr. Michael Chung, my guest in studio today. We're talking about occlusion problems and how they produce sleep apnea conditions, and we're going to talk a little bit about dental bracing in a second. I want to get to another one of our phone calls because many of you are holding very patiently, and I don't want to disappoint you. Deborah, how can I help you? Thank you for calling.
Dr. Roselle, I've been just diagnosed by a vascular surgeon having artificial phlebitis, and I'm on a indomethacin 75 mg pain pill for redness and swelling for 7 days, and I'm about to take a 22-hour plane trip. And he prescribed compression stockings for this trip. But how do I avoid complications while abroad for a month, and how to best treat this type of phlebitis?
When are you leaving?
on Thanksgiving.
Okay, so you don't
Thursday.
have a lot of time.
No.
And so the situation is one that you really can't do a lot of conservative things for it. You know, first of all, thrombophlebitis or also phlebitis, when you listen to the television commercials, you hear things like DVTs, right, deep vein thrombosis, and that's when it gets really bad. And it's the deeper veins, the superficial ones where you look at the skin and you see all these rupture of capillaries, and sometimes the skin gets hot, generally in the lower extremity, but it can be in the hands as well, and the arm. And it comes about for a lot of different reasons. One, simply because there's too much pressure on the veins as they return, so they back up, they stagnate, and subsequently they start popping, they start breaking. Too much weight, not enough muscle tone, not enough exercise, dietary patterns can all be involved in this type of thing. And over the years, you know, if a patient really steps up to the plate and makes some changes, lots of good results can be had. High levels of vitamin C. What do I mean by high levels? Well, you're not my patient, so I can tell you can take maybe 3,000 milligrams a day, 1,000 3 times. The side effect for vitamin C is simply that you might get a little bit of intestinal rumbling, a little, maybe if you're real sensitive to it, you might get a little diarrhea, but then you just back it down a little bit. That will help. There's a component, it's a bioflavonoid called Cyruta, and Cyruta will help the capillary fragility. Anything that's inflammatory, there's very nice anti-inflammatory products that are out there, but again, you're not my patient. I don't know what you're going to react to, so I'm hesitant to tell you. I'd have to have more information from you. But those are things that you can do. The compression socks for the airplane trip, probably not a bad idea. The other thing that you want to do is you want to make sure that you drink a lot of water every day, because you want to move the stasis of the lymphatic system, and you don't want it to accumulate, because that'll put more pressure on the legs and the lower extremity. So if you do those things for right now, vitamin C, Cyruta, the compression socks, lots of water, watch the type of soft foods that you have in your system. On the plane, get up and walk around. Don't just sit there. Contract your muscles of your legs, tighten them, to contract the muscles of your buttocks, and then kind of push against the seat with your legs. Pump that pump that lymphatic fluid around. That will help you. That'll make a big difference. So try those things. When you get back from your trip, send me a note. I'll give you more data. I hope that's helpful. I'm sorry you're going away right now, because there's other things I could tell you to do, but that will help, okay?
How do you spell Cyruta?
Cyruta. Cyruta.
T-A?
T-A, like Thomas Anthony. C-Y-R-U-T-A.
R-U-T-A.
Okay?
There is one thing, the horse something. It's a supplement.
Horsetail?
Yeah, horse. I can't.
Horse chestnut will help as well. But it has to be in a very specific preparation. Don't worry about that right now.
Okay.
Just do those other things, and then let me know when you come back, okay?
Thank you so much.
You're welcome, Deborah. Thanks for calling. Dr. Mike, let's talk a little bit about TMJ. We have a couple people there. Let's go to Cindy, actually. Cindy, thank you for calling.
Thank you. I had a question about the TMJ. When I was 4 years old, I broke my jaw and had a whole head cast. Now that I'm in my 60s, having some problems with my right jaw, and went to the dentist, and they did a CAT scan on it and said, that I have an overbite and that I should have braces put on. But listening to you, I'm a little concerned now if I maybe should look into a little further than just have braces on.
Dr. Mike.
Yes, correct. It is common that most of the TMD patients have an overbite, but if just putting on braces blindly can sometimes worsen the situation. So it's very important that we bring back the correct neuromuscular balance and bite first, and then move your teeth orthodontically to that corrected position versus just moving teeth and just correcting the overbite only. Because, aesthetically and functionally it may look right, but it may not be in the correct position in terms of your airway and your joints and everything else. So,
well, I had sleep apnea, and then I had gastric bypass, so I lost, about 80 pounds, but now what's happening, it seems like the jaw is relaxing, that I'm sleeping with my mouth open all the time, and I don't know. So I think it's more in the joint. Yeah.
Right. So you would be an ideal candidate for this K7 analysis.
Okay.
Because it is almost impossible to see this subjectively by any doctor without going through this testing, and
Right.
and we would be able to pretty much find the corrected position for you, and then we make sure that is the correct position by making you an appliance called an orthotic, where you would wear it for a few months to make sure that it is comfortable there and that you are getting the right amount of air and breathing well, and that is probably the first step you want to do instead of blindly doing braces.
Cindy, go and make an appointment to go in to talk to Dr. Mike. He's, he'll sit there and he'll go over your case. It's our gift to you. It's his gift to you. Give him a call, 703-319-6990, and he'll lay it out for you. But you know what? Historically, the kind of patients that we've seen that are identical to your condition can't just have an appliance thrown in, because you dramatically worsen the situation. You could potentially cause headaches. You can cause imbalances within the body. Not something that you want to go through. So give them a call and let us know if we can be any help to you as well. Okay?
Thank you so much.
Cindy, thank you for calling. Appreciate it. 888-630-9625. Dr. Mike, we have more calls and we're going to get to them in a second, but let's talk a little bit about dental bracing, and because years ago, dental bracing was one of those things where you put wires on people's teeth and you hook the mouth together and all that stuff, and people ate their meals with straws and yada yada yada, right? So now we've got many different types of dental bracing, including Invisalign, which is everybody wants to run to because they can't. Nobody knows that they have braces on. But regardless of whether it's Invisalign or you're spreading palates or anything else, it has to be done in a way that protects what we call the vertical dimension of the mouth. And because if you shift that vertical dimension, you're going to mess up that temporomandibular joint and how it sits, and subsequently, because it is the pump handle for the rest of the skull and the upper neck, you're going to cause a plethora of neurological problems.
Yes, that is absolutely correct, Dr. Roselle. Because of the imbalances that you can cause, you want to make sure that we find the correct vertical dimension and occlusion before we do any permanent movements, whether it be through orthodontics or through restorations of the mouth. We would definitely want to figure out the correct neuromuscular dimension, the vertical dimension, and clear the airway before we start anything permanent.
When you're dealing with Invisalign, so here's a question that patients will ask me, and obviously I refer them to you on a regular basis. Is everybody a candidate for Invisalign?
Well, everybody can be if all you care about is having teeth that look good. That does not necessarily mean that functionally they'll be in the correct position. The only way people can really judge, the braces usually, do they look straight? Do they look good? But in reality, if they're not in the correct vertical dimension and correct position for your airway and your joints, it is a failure, and eventually the teeth will move back because it is not in the correct position. So, like we were saying all along the show here, that we need to find the correct neuromuscular occlusion first, then and only then do we start moving permanently the teeth in the muscles and everything else in the correct position. Then it can be a long-term solution.
Can somebody be corrected with regular braces or Invisalign, and once you find out where it needs to be? I guess my question is this: do you make the Invisalign correction based on your diagnostic findings, and is that what the difference is?
Well, Invisalign is very difficult to control the vertical dimension of it. Invisalign is a great tool for minor rotations and some cosmetic tweaking here and there, but it is not a tool that we normally would use to correct three-dimensionally. So for that reason, normally to correct sleep apnea or neuromuscular occlusion issues, normally we have to use traditional braces and move the teeth in a three-dimension way.
My guest in studio, Dr. Michael Chung, owner-director of Soft Touch Dental in Oakton. And you can get them online at softtouchdentalcare.com, and that's soft touch with one T, SOFTOUCH dental, DENTAL, care, CARE.com, or give them a call at 703-319-6990, 703-319-6990. Dr. Chung has been kind enough to offer Roselle Center patients and also Dr. Tom Roselle Live patients a complimentary consultation at, all you got to do is pick up the phone and call them. And if you'd like to have a full exam done, an initial introductory examination, new patient examination, he's willing to do that with x-rays if necessary for $79. So you can just go in and talk to him and get his opinion, or you can go in for an exam and establish yourself as a patient. That $79 is a $300 value. So give him a call, 703-319-6990. This area is fascinating to me, Dr. Mike, because we have so many patients that come in that have so evolved neurological presentations. They're complaining of neck and arm pain, headaches, I don't feel good, brain fog, and we do a lot of work with them, and then we see them sometimes not hold, not stabilize, or we can't get them beyond 80% or whatever it is, and then we realize, and we have ways of checking it functionally, that it's a TMJ problem, and we send them to you, and then it makes a huge difference in the restorative recovery. We're coming up to a break. Don't go away.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio today. 888-630-9625. That's how you find us here. How you find us outside the program is you go to rosellecare.com. That's ROSELLECARE.com, or call us at 703-698-7117 and let us know how we can help you. My guest today, Dr. Michael Chung. We're talking about sleep apnea conditions, neuromuscular dentistry, Invisalign braces, and so forth. And Dr. Chung is, when it comes to neuromuscular position of the mouth, this guy knows really where it's at, because you can't just have things done to your mouth. I think when I first went in to start seeing Dr. Mike, and all of you have been to the dentist and they've had work done, and they take the little carbon paper, Mike, after you're done with the work, and you go tap, 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 tap. And I said, no, Mike, sit me up to do it. And it's because that's the way the mouth is supposed to be. And you can find that with your case 7.
Correct. Absolutely. You can even test it for yourself if you sit up straight and tap, 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 and notice where you're touching your teeth, and you lean your head back and tap, 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 and you're always going to find a different spot where it hits. So there's a huge correlation here between the position of your upper and lower jaw and your posture.
Postural patterns have to do with everything from the top down, and we're talking about the mechanics of the skull. We're talking about the mechanics of the temporomandibular joint. And if you really want to know if you're positionally correct, if if that snoring that you're getting, if that fatigue pattern that you have is because you're opening your mouth all night long and you're not breathing normally, or you're stopping your breathing pattern throughout the night, it's really something that needs to be evaluated properly. And the only way that I know how to evaluate it is this. Mike, we got about a minute or so. Let's talk a little bit more about what that really means neuromuscularly to the body, and why it's important that people do it the right way.
Yes. obviously sleep apnea can, left untreated, will cause all sorts of issues such as diabetes, heart problems, blood pressure. I mean, it is basically you're starving your organs of oxygen. So it is very, very important that not only are your teeth nice and straight and put in the correct functional position, but that it is in a correct neuromuscular position as well for your airway. So, and there's only one way that I know is by the system of K7, where we can actually analyze all those three dimensions and put you in a correct neuromuscular balance.
It's a very cool study. I mean, you sit there and you get hooked up with a TENS unit, and he knocks out all of the imbalanced muscle contractions that support your head and neck, and then he has you open and close your mouth, and on a computer screen you're seeing how the mouth aligns itself, and then the correction is done to position it properly, and suddenly you've got a new mouth. You've got a new life. It's really incredible. I love watching this stuff when I go over to your office and just hang out. It's kind of neat. Dr. Michael Chung, my guest in studio today. You can reach Dr. Chung at 703-319-6990 for a complimentary consultation. If you think you've got a problem, if your wife, guys, has been complaining that you snore way too much, give Dr. Mike a call. If you'd like to establish yourself as a new patient, you can do that by just calling them at that same number, and $79 will get you in the door. This is Dr. Tom Roselle. We're here every week, 12 noon, bringing you the best intimate information on integrative care. See you later. Bye.